My name is Dr. Saifi and I'm an orthopedic spine surgeon at the University of Pennsylvania.
And I'm Dr. Yoon. I am a neurosurgeon specializing in complex spine surgery. Today we're going to discuss what the right type of surgery is for you.
I have many patients who come to me both through Penn or from outside institutions who have significant pain. Often these patients will have leg pain or arm pain and or back pain. We also treat many patients with severe spinal deformities. And for these patients, we often have a conversation in depth about whether they're a candidate for minimally invasive spine surgery or traditional open surgery.
There are type of conditions where it becomes more urgent, that the decision for surgery needs to be made fast. But for elective procedures, you want to talk to all the specialists, have all the options, and understand the risk and benefits of each one. Once you get to the point where you need a spine surgery, there are multiple options. One option is having a open, where midline incision is made, and you can address a more complex disease. And there's another type of surgery that can be done that's a minimally invasive option where the surgeons can make a smaller incision and more targeted approach to address a pathology. And that really depends on the type of pathology the patients have.
Certain conditions, such as herniated discs, are often best treated with minimally invasive approaches in which a incision less than 20 millimeters is typically made and the patients go home the same day. There is also another option. Dr. Yoon performs endoscopic surgery. Can you tell us a little bit about that?
Mm-hmm. So the endoscopic surgery is a special type of MIS operation where the surgeon uses a endoscopic camera to remove a piece of disc or open up a opening for the nerves. So instead of using a tubular, which is a little bit larger diameter, is about 20 millimeters, we use about 8 millimeter tubular ports, and then the camera is passed, and then the disc can be removed or the foramen could be opened. Now, not everybody is a candidate for endoscopic surgeries, but it's a type of minimally invasive surgery that can really minimize any collateral damage so the patient has less pain post-operatively.
Certain surgeries, however, such as complex spinal deformities, which I often treat, are not amenable to minimally invasive, but some spinal deformity surgeries are amenable to minimally invasive surgery. It's just important that you discuss with your surgeon those specifics and your interest in minimally invasive surgery.
Traditionally, the surgery are done from the back when the patient is laying down on the table, and you approach the spine from the back, making an incision this way. The side operation, direct lateral interbody fusions, are done to the side. So instead of making an incision from the back, we make an incision on the patient's flank, and then we can get directly down to the disc. And this is a very, very powerful operation that's minimally invasive, where the patient has a abnormal curvature. We can approach the spine from the side and really correct their deformity, and then also not disrupt all their muscles to do that.
I agree. I've had many patients who we've done this minimally invasive fusion option who go home the same day from surgery. Typically our patients for an open fusion stay in the hospital 3, maybe even 4 days. But with the minimally invasive option, they can go home either the same day or the next day. With patients who have a severe curvature of the spine or scoliosis, they sometimes are a candidate for minimally invasive, but sometimes not. And so we have to discuss that with the patient. Sometimes it's just a risk-benefit discussion of whether the patient feels that they want minimally invasive, and we discuss how that would benefit them versus an open approach. So it's really a discussion with the patient about what they feel is best for them.
If their disease really involves multi-level, meaning that it's not just the one side of the herniated disc, is from entire lumbar spine, then the risk and benefit of doing the minimally invasive spine surgery goes down. So in that case, then open approach may be a better option for that patient. There are two different types of spine surgeons, like Dr. Saifi, who's an orthopedic spine specialist, and myself, a neurosurgery spine specialist. We both perform a minimally invasive surgery as well as the open traditional surgeries. But we both have a different training, but we work with each other. So for the patient, you want to go to a place where you can have both representation and you have experts from both neurosurgery and orthopedics.
Often at the spine center, Dr. Yoon or myself will send each other our patients to have a discussion about that with other providers here.
For example, in our center, we have weekly spine conference where not just two surgeons, but we have both the orthopedic departments and the neurosurgery department. All the doctors get together and review a case. So you get opinions from at least 20, 30 providers who offer their opinion and really formulate the best individualized and sort of customized treatment plan. And you can get that at Penn Medicine Spine Center. Please go to the Penn Medicine Spine Center website for more information.